Healthcare leaders and local colleges seeking solutions to the burnout being felt by those in the medical field. Years after the height of our pandemic that we saw, there are still long wait times at both hospitals and for in-home care. The burnout, though, it's leading some in the industry to leave for other jobs.
The North Carolina Department of Health and Human Services is creating a leadership team now to tackle this problem and create a path forward. WCNC Charlotte's Lexi Wilson joins us live from outside Uptown to talk about those efforts. So, Lexi, what does this group want to do?
Well, state health officials want to work on keeping the staff they already have, but at the same time, they also want to be training the next generation of healthcare workers. Now, local community colleges are also stepping up.
So we could potentially float.
As the calls to solve the shortage of healthcare workers get louder, the Associate Dean of Nursing and Nurse Aide at Central Piedmont Community College, Monica Burnett, knows there are fewer nurses in our healthcare systems.
I'm a nurse myself, so I see it every day on the front lines, the needs that we have out there. And as Charlotte grows, we'll have even more of those needs.
Before the pandemic, North Carolina already expected a shortage of 12,500 registered nurses by 2033. That is now expected to get worse, according to the UNC Shepp Center.
This is an issue that impacts all North Carolinians.
Karen Wade, policy director for the North Carolina Department of Health and Human Services, says if something isn't done to stem the tide, this could take us into a healthcare crisis of huge proportions.
It impacts our health and well-being. It also impacts our workforce across the board, and as an economic impact as well. So it's really something that we need to come together as a state to address.
The state addressing the problem with the Caregiving Workforce Strategic Leadership Council, a group of healthcare leaders working to create the roadmap to fix the shortages. Their focus points are direct care, nursing, and behavioral health, with the goal of improving recruitment, retention, and training. Creating the future generation, something that Central Piedmont Community College is working to tackle.
It's exciting for Central Piedmont because we're offering now options that we didn't before. You know, we've got this accelerated ADN path that no other community college is doing.
Meanwhile, Burnett says it can be a difficult job, but this profession is full of purpose.
Being able to see at the end of the day, my patients get well and go home. And the other side in the education piece, growing and seeing that light bulb moment when students start and they don't even know how to knock on the door and get in to the patient's room, and to the very end when they're walking, talking, and acting like a nurse. It's just a blessing to know that you've touched somebody's life.
And if you would like to learn more about the expansion at Central Piedmont, we have all of that information on our WCNC mobile app. Reporting live just outside of Uptown for WCNC Charlotte, I'm Lexi Wilson.